This is Health Broadcasting Service, HBS Radios, your global pioneers in specialist radio broadcasting, bringing you everything to enhance your health and well-being. Health is your human right. HBS, your partners in everything about your health and well-being.
Health Broadcasting Service, HBS Radio. HBS Radio is who you're looking for.
Weekly news update, coming to you from the Health Broadcasting Service. HBS Radio Channel. First woman reported cured of HIV after stem cell transplant. A United States patient with leukemia has become the first woman and the third person to date to be cured of HIV after receiving a stem cell transplant from a donor who was naturally resistant to the virus that causes AIDS, researchers reported on Tuesday. The case of a 64-year-old woman of mixed race, presented at the Conference on Retroviruses and Opportunistic Infections in Denver, is also the first involving umbilical cord blood, a new approach that may make the treatment available to more people. Since receiving the cord blood to treat her acute myeloid leukemia, a cancer that starts in blood-forming cells in the bone marrow, the woman has been in remission and free of the virus for 14 months, without the need for potent HIV treatments known as antiretroviral therapy. The two prior cases occurred in males, one white and one Latino, who had received adult stem cells, which are more frequently used in bone marrow transplants. This is now the third report of a cure in this setting, and the first in a woman living with HIV, Sharon Lewin, president-elect of the International AIDS Society, said in a statement. The case is part of a larger U.S.-backed study led by Dr. Yvonne Bryson of the University of California, Los Angeles, and Dr. Deborah Persaud of Johns Hopkins University in Baltimore. It aims to follow 25 people with HIV who undergo a transplant with stem cells taken from umbilical cord blood for the treatment of cancer and other serious conditions. Patients in the trial first undergo chemotherapy to kill off the cancerous immune cells. Doctors then transplant stem cells from individuals with a specific genetic mutation, in which they lack receptors used by the virus to infect cells. Scientists believe these individuals then develop an immune system resistant to HIV. Lewin said bone marrow transplants are not a viable strategy to cure most people living with HIV. But the report confirms that a cure for HIV is possible and further strengthens using gene therapy as a viable strategy for an HIV cure, she said. The study suggests that an important element to the success is the transplantation of HIV-resistant cells. Previously, scientists believed that a common stem cell transplant side effect called graft versus host disease, in which the donor immune system attacks the recipient's immune system, played a role in a possible cure. Taken together, these three cases of a cure post-stem cell transplant all help in teasing out the various components of the transplant that were absolutely key to a cure, Lewin said. In another development, Disney World to drop mask mandate for vaccinated guests. Disney World plans to make masks optional for fully vaccinated guests from Thursday, an update on its website showed, reversing a policy introduced in mid-2021. The easing of the mask mandate comes after Universal Orlando Resort and cruise operator Norwegian Cruise Line Holdings Limited also made face coverings optional for their guests. Disney World in Orlando, Florida, operated by Walt Disney Company, said it expects guests who are not fully vaccinated to wear face coverings in all indoor locations, including theaters. An update on Disneyland California's website showed masks were required for unvaccinated guests in all indoor locations, while face coverings were optional outdoors. Disney World and Disneyland both said masks will still be required in certain indoor settings, including transportation. Many major U.S. firms, including Goldman Sachs, J.P. Morgan Chase & Co., have also made masks optional for their workers, although President Joe Biden said last week dropping COVID-19 mask requirements entirely was probably premature. And that is all we have for you on this segment. We will be back with more updates as news develop. Please engage with us on our social media, Facebook, and Instagram platforms at Health Broadcast. You can also visit our website at www.healthbroadcastingservice.com. Remember to press the subscribe button to stay abreast of vital, interesting, and authentic health news from across the globe, brought to you by the Health Broadcasting Service, HBS radio channel. Stay safe and remain healthy.
This is Health Broadcasting Service, HBS Radios, your global pioneers in specialist radio broadcasting, bringing you everything to enhance your health and well-being. Health is your human right. HBS, your partners in everything about your health and well-being.
Health Broadcasting Service, HBS Radio. HBS Radio is who you're looking for.